tricuspid valve atresia with detransposition of great arteries. So in this image, this is subcostal view. You can see this is liver. This is right atrium. This is right ventricle. This is tricuspid valve atresia. You cannot find out tricuspid valve. Only thickened fibrous portion that is not allowing any connection between right atrium and right ventricle. From right ventricle, the aorta is getting supply. Aorta is narrower in size compared to pulmonary artery. So this is right atrium, this is right ventricle, and this is aorta, and this is pulmonary artery. Pulmonary artery is relatively bigger than aorta. In this view, this is subcostal view. Now the next image, you can, this is parasternal long axis view. This is left ventricle and this is pulmonary artery, and this is left atrium. So left atrium to left ventricle and then to pulmonary artery. So whenever you find pulmonary artery coming out of left ventricle, even in the beginning it goes posteriorly, and pulmonary artery and aorta both are parallel in orientation in the beginning of its course. So whenever you have to find out detransposition, try to see how aorta and pulmonary artery is in the beginning. So this is pulmonary artery, this is aorta. In the beginning both are parallel, so indicating transposition of great arteries. In this case, left atrium to left ventricle and right atrium to right ventricle, so AV concordance and VA discordance, atrioventricular concordance and ventriculo-arterial discordance. So this is case of detransposition along with tricuspid valve atresia. So this is parasternal long axis view. So whenever you find transposition of great arteries, what you will find in the beginning, if so pulmonary artery arises from left ventricle and goes posteriorly. In case of aorta, if aorta is arising from left ventricle, that it would go anteriorly, not posteriorly. So as it goes posteriorly, so it is pulmonary artery, not the aorta. At the same time, you can see the bifurcation also. So next image, you see this is tricuspid valve atresia, thickened echogenic valve. This is mitral valve. There is inlet VSD and both valves are arising from the same level. Whenever you find inlet VSD, that is the part of AV septal defect. So that is called partial AV septal defect, because inlet VSD you will find both this left side portion of atrioventricular valve and right side portion, that is tricuspid portion and mitral, both are coming from the same level. That is the point to know. So that is the characteristic of AV septal defect. So this case has got inlet VSD also. This is the next image. You can see the whole blood from the right atrium has to go into left atrium through ASD, because there is tricuspid valve atresia. The blood of right atrium has to go to left atrium. So in this image you can see this is right to left flow. That means flow from right atrium into left atrium, blue in color. So downward flow, this is right atrium and this is left atrium. Now the next image, again you see same thing, red flow. So this is left atrium, right atrium, but mostly flow is right to left. See, right to left, right to left, right to left. So flow is, though it is little bit bidirectional, mainly right to left, because all the blood from right atrium has to go into left atrium. From there it will go into left ventricle. You can see this inlet VSD and blood is going from left ventricle into right ventricle. The small amount of blood is going into right ventricle. This is the location of inlet VSD. This is the location of ASD. This is right atrium and this is left atrium. Again this is subcostal 4 chamber view. This is left atrium, this is left ventricle, this is right atrium, this is right ventricle. Very does not base right ventricle is not seen clearly in this image. So in this case, what you see, the right ventricle is not seen this way clearly, but right ventricle is small in size compared to left ventricle. So this is left ventricle, this is inlet VSD, and this is pulmonary artery. You can see this is pulmonary artery, and this is aorta. This is left atrium, this is parasternal long axis view, this is left atrium, left ventricle, pulmonary artery, from right ventricle, aorta. Here you will see the bifurcation of pulmonary artery, right and left, and this is aorta. Aorta is anterior and slightly left of that of pulmonary artery. This is at tricuspid or atresia. This is mitral valve, and this is inlet VSD. Now very clearly see in this image, this is left atrium, left ventricle, aorta. This is left atrium, left ventricle, pulmonary artery, not aorta. This is pulmonary artery, and this is right ventricle and aorta. So both are parallel in initial course, indicating transposition of gate arteries from left atrium, left ventricle, and then pulmonary artery. Look, this is pulmonary artery, this is aorta. Aorta is anterior and slightly left. This is whole is left ventricle, this is left atrium, this is right atrium. So ultimately this case is D transposition of gate arteries, inlet VSD, ostium secundum ASD, tricuspid atresia. These are the findings in these cases. Thank you.